In the United States, healthcare has become a major area of debate, especially among Democrats. Many people are dissatisfied with the current system, and with healthcare costs on the rise, the question of how to reform healthcare is becoming increasingly important. In order to gain a better perspective on the issue of healthcare, we are going to take a look at the healthcare systems of several countries from around the world. Hopefully, this will provide us with a useful perspective and give us some insights into the different ways that healthcare can be organized. France is often ranked as having one of the best healthcare systems in the world, so that is where we will begin. The French healthcare system developed over time. In 1930, France created a program that required employers to help finance healthcare for their low-income employees. This program was limited to workers in the sectors of industry and commerce, and only to those who made below a certain level. In 1945, following World War II, this program was expanded and a new healthcare system was built. The new system covered all industry and commerce workers along with their families. This was a major reform and is often viewed as the start of the modern French healthcare system. Over the next several decades, coverage was expanded to include additional occupations such as agricultural workers and the self-employed. Finally, in 2000, a new law brought universal coverage by basing healthcare eligibility on residency and making all legal residents eligible for coverage. Healthcare coverage was initially expanded by creating new healthcare plans or insurance funds for different occupations. Many of these funds have since been combined so that currently there is one main fund and a variety of smaller ones. The main fund, which is referred to as the general scheme, is the plan that was originally created for workers in industry and commerce. It now also covers the unemployed, those with low incomes, as well as the self-employed. Around 90% of people are covered under this fund. The second largest fund is the one for agricultural workers, which covers around 5% of the population. The remaining funds are even smaller. They cover specific occupations such as mine and railway workers, or people in certain geographic regions. These funds provide mostly the same level of benefits, but there are some small differences between them. It's important to keep in mind that unlike health insurance in the United States, health insurance in France is not run as a for-profit industry. The goal of French health insurance is to help people by creating a system of financing that is able to cover everyone's healthcare expenses. The various health insurance funds are all non-profit institutions and operate only for the benefit of the people they cover. These insurance funds make up what is called statutory health insurance, or SHI. SHI is a network of non-profit insurance funds that provide healthcare coverage. SHI and French healthcare in general is a publicly funded system, meaning it is primarily funded through taxes. Most of the funding comes from a Social Security payroll tax and a tax on income. Although funding is mostly through public sources, most general practitioners or family doctors are private workers and are self-employed. They are generally paid standardized fees for the services they provide. Doctors' unions engage in yearly negotiations with the insurance funds and the government to set the prices for these services. Most hospitals are public institutions, but there are also many private nonprofit and private for-profit hospitals. Patients can choose to go to any doctor or hospital that they want, and their insurance will pay for it. In France, healthcare is viewed as a fundamental human right. Because of this, they have designed their system so that everyone is fully covered. There are a number of programs and policies in place that ensure that this goal is achieved. First, people who lose their jobs, who are unemployed, or who have a low income continue to receive healthcare coverage regardless of their ability to pay. The government, through taxes, covers the cost of their health insurance premium when they cannot afford it. Along with this, to make sure that no one is overburdened by excessive costs and that people don't avoid treatment due to high prices, there are limits on the costs that patients have to pay. For many services, patients pay a percentage of the total cost, usually around 30%. A doctor's visit, for example, may cost around $45, but a patient will only end up paying around $15. However, for expensive services, such as surgeries, testing, and long hospital stays, patients are exempt from paying a percentage and are instead only charged a small fee. People don't have to pay thousands of dollars to receive the care that they need. In addition, most people also have supplementary private insurance, which pays for expenses that are not covered by their main healthcare plan. People with low incomes can get free supplementary insurance through a government program. Another key policy of the French healthcare system is that people who are diagnosed with long-term illnesses, such as cancer, diabetes, or dementia, are exempt from all expenses related to their illness. The French have a strong sense of national solidarity, and they believe in working together and making sure that everyone's basic needs are met. This is why they have such a strong focus on making sure that healthcare coverage is extended to everyone. Healthcare, however, is only one aspect of this solidarity. The healthcare system is in fact just a part of the larger French social security system, which provides a variety of social benefits in the key areas of health, family, and old age. It is a strong system that makes sure that children, the elderly, families, the sick, and the poor all have their basic needs met. While the French healthcare system manages to cover everyone, it also provides a very high level of quality. As already mentioned, France is often ranked as having one of the best healthcare systems in the world. Along with this, France has one of the highest life expectancies in the world. France spends about 11% of its GDP on healthcare. Cost is always a concern for modern healthcare systems, especially as costs are on the rise. Like most other developed countries, France faces the problem of increased costs due to the development of more advanced treatments and equipment, and because much of the population is getting older, which means that healthcare services are used more frequently. While cost is a concern in France, spending on healthcare in France is minimal compared to the United States. France spends about 11% of its GDP on healthcare, while the United States spends close to 17%. The difference is even more extreme when comparing the cost per person. France spends about $4,700 per person per year, while the US spends about $10,900 per person. France is able to provide excellent quality healthcare, all at about half the cost per person compared to the United States. The next country we are going to look at is the United Kingdom. Like France, the healthcare system of the UK was created in the years following World War II. While World War II was still being fought, the government of the United Kingdom established a committee to investigate the possibility of creating new social programs in Britain. Eventually, this committee published a report that, among other things, recommended the creation of a national healthcare system. Healthcare would be funded by taxes, and the system would be run by the government. Everyone would be covered, and healthcare would be free at the point of service. This report, known as the Beveridge Report, after its most famous advocate, William Beveridge, became very popular and received nearly universal support. Amid the struggles of war, people in Britain felt a strong sense of solidarity and national unity, and they were excited by the idea of creating a healthcare system that would provide for everyone in the country. The report was even distributed among members of the military to boost their morale and give them pride in their country. At the end of World War II, a liberal government was elected, and they began the work of creating this system. There was opposition from existing health insurance organizations and from doctors, many of whom did not want to become government employees. However, the plan remained very popular among the majority of people. To appease the doctors, compromises were made. Mainly, general practitioners would be allowed to remain as independent workers. The plan moved forward, and legislation creating this new system was passed in 1946, and in January 1948, the National Health Service, or NHS, became active. This made Britain the first country in the world to provide universal health care. The NHS has now been in service for over 70 years. It remains a very popular program, and all major political parties in the UK support it. The system is still mostly the same as when it was created. All basic services are covered so that patients generally don't have to pay anything. Taxes are the primary source of funding. The government is responsible for managing the system and ensuring that patients are provided with the health care they need. In England, the national government manages the healthcare system, while in the regions of Wales, Scotland, and Northern Ireland, healthcare is managed by local authorities. Most hospitals are run by the NHS, and most hospital doctors are government employees. General practitioners, however, are usually independent workers, but they receive the majority of their income through contracts with the government, where they are paid based on the number of patients that are registered to their practice, as well as other factors. One interesting aspect of healthcare in the UK is that there is a strong focus on efficiency. The UK has even been ranked as having one of the most efficient systems in the world. The NHS promotes efficiency by carefully monitoring the outcomes of different practices, policies, and treatments, and implementing changes to make sure that the most beneficial and cost-effective ones are put into place. This includes limiting coverage to only treatments that are proven to be effective, only conducting tests when they are necessary, and requiring referrals for appointments with specialists. These practices save the system money, but they sometimes create difficulties for patients. The National Institute of Health and Care Excellence, or NICE, plays a key role in this area. Another key part of the NHS's focus on efficiency is community health and disease prevention. Prevention is one of the best ways to reduce healthcare expenses. Even limited resources can have a big impact. One example of this is in the area of smoking cessation. Smokers are provided with free counseling, nicotine replacement products, and other forms of support to help them quit smoking. Because smoking is a major risk factor for many illnesses, this is a very good investment. One of the advantages of the UK's system over that of the United States is that because healthcare is run on a national level, the government has strong bargaining power to help keep costs down for medicines and other medical goods. This is also true in France, where the government plays a strong role in managing prices. On average, people in Britain spend around $500 per year on pharmaceuticals, while in the US, people spend over $1,300. Overall, Britain spends around 10% of its GDP on healthcare, while the US spends again close to 17%. That is $4,300 per person in the UK compared to $10,900 per person in the US. Just as with France, even though the UK provides healthcare for all of its citizens, it still pays much less than the United States. In general, the lower costs are the result of the strong role that the government plays in managing the system and its focus on efficiency. The benefit of this is that costs are kept under control, but it also means that the UK often doesn't spend enough on healthcare. In recent years, funding for the NHS has not risen fast enough to keep up with the ever-rising costs of healthcare. Since 1948, funding for the NHS increased by an average of about 3.7% per year. During the 2010s, however, spending increased by only around 1.6%. While in general the UK does provide a good level of quality of healthcare, it does struggle, especially in the area of waiting times, as a result of this limited funding. Limited funding leads to limited numbers of doctors and nurses, and as a result, longer waiting times. This is one of the system's main problem areas. Despite this, the NHS is still very popular. Many people in the UK are proud of their system and are calling for reform and greater support for the NHS. They believe that funding the NHS should be a much higher priority. Since 2018, the Conservative government of the UK has made commitments to increase funding for the NHS. There is hope that this will help alleviate some of the problems the system faces. However, many believe these increases are not enough and that greater investment is needed. In 1944, a man named Tommy Douglas was elected governor of the Canadian province of Saskatchewan. As governor, he made healthcare reform a priority and established a new healthcare program that eventually became the model for all of Canada. Earlier, during the Great Depression, Douglas had been greatly disturbed by seeing so many people suffer and die because they did not have access to basic medical care. As a church pastor, he was responsible for burying many of these people. Seeing the terrible circumstances that people were living through drove him to become involved in politics, and when he was elected governor in 1944, he got to work on healthcare. By 1947, he had created a provincial insurance plan that made hospital treatment free for everyone in the province. It was paid for by a premium or tax that citizens of the province paid to a provincial insurance fund. This system was so successful and popular that other provinces began to implement the same plan. Eventually, all provinces adopted it. In 1961, Douglas led the way once again by expanding the system so that it would cover doctor's visits in addition to hospital stays. This new system was called Medicare. Once again, the new plan became very popular on a national level, and other provinces created their own Medicare programs with support from the federal government. Each Canadian province is responsible for managing its own Medicare program. Provinces set their own rules regarding what services are covered, how much doctors are paid for those services, whether patients have to make co-payments, and so on. However, provinces must work within the rules that the federal government has established. The general guideline is that provinces must provide universal coverage for all necessary treatments. They must also meet certain standards of quality set by the federal government. Because provinces receive much of the funding for their Medicare programs from the federal government, they are obligated to meet these requirements. However, there is still a lot of room for variation between provinces. Most Canadians pay nothing for doctor's visits, MRIs, hospital stays, or ER visits. Prescription drugs are generally not covered, except in some cases for certain groups of people, such as the elderly, the poor, and those with chronic illnesses. Some provinces are more generous in the services they cover, others are more limited. Like the UK, the national character of Canadian healthcare gives the system great bargaining power over the costs of medicine. In Canada, drug prices are often half to a quarter the cost of what they are in the US. Many people in Canada also have private insurance through their employers or directly, as it is quite cheap. But private insurance is not allowed to be duplicative. It cannot cover services that are already covered by Medicare. While health insurance is run as a public institution and most of the funding is public from taxes, most doctors are private and independent. They act as contractors for the government and are paid in return for services they perform for patients. Most hospitals are either run by regional health authorities or by private, non-profit organizations. Similar to the United Kingdom, Canada provides good quality healthcare but does struggle with waiting times. The level of healthcare funding is such that there is often a limited number of doctors and other healthcare resources, and thus long waiting times. Waiting periods vary from province to province and based on the type of problem. Canada spends about 11% of its GDP on healthcare, which is about $5,000 per person. Again, this is much less than the United States. Canada's problems with waiting times could be greatly reduced or even eliminated if they chose to spend more on healthcare, and they would still be spending much less than the United States. For each of these three countries, the majority of their healthcare spending comes from public funding. It is money that is raised through taxes and spent by the government or other public institutions on healthcare. In the UK, about 80% of healthcare spending is from public sources. In France, it's about 75%, and in Canada, about 70%. The way this money is spent is different due to the different structures of each country's healthcare system, and the money is raised in different ways, but generally speaking, the money comes from taxes and provides the majority of healthcare funding. On the other hand, In the United States, only about 50% of healthcare spending comes from public sources. The rest comes from private, for-profit health insurance and from out-of-pocket payments made by patients. In Canada, France, and the UK, private insurance and out-of-pocket payments also make up the remainder of healthcare spending, although they are a much smaller proportion. A key difference is that private insurance in these countries is limited to a supplementary role, meaning that private, profit-driven health insurance is kept out of the core of healthcare coverage. This is a major reason why costs are so much higher in the US compared to these other countries. Most developed countries around the world have a healthcare system that can be grouped into one of three categories based on the basic model of healthcare that they use. The countries we have just looked at are examples of this. Canada uses what is called the National Health Insurance model of healthcare. In general, NHI healthcare systems are defined by having a nationwide insurance fund that covers all citizens. Canada fits within this model, but is slightly different because health insurance is subdivided among the provinces. The United Kingdom uses what is called the Beveridge model of healthcare. This model was first developed in the UK and, as mentioned earlier, bears the name of William Beveridge, who was instrumental in its creation. In Beveridge model healthcare systems, healthcare is run directly by the government. The government provides the funding and most of the healthcare services. The French system was founded on the Bismarck model of healthcare. This system is based on private but non-profit health insurance funds, where health coverage is usually closely linked to a person's employer or occupation. While French healthcare initially developed based on this model, it has changed over time to be more like a national health insurance system, with some aspects that are similar to the Beveridge system. In the next video, we will look more in depth at these three models and their many variations, and explore additional examples of countries that use them, including Japan, Germany, Taiwan, and Italy.